With the rising number of confirmed coronavirus cases both in Dallas County and the rest of the country, what steps do we need to take in order to ensure the safety of our scholars, families, loved ones, and communities? Joining us now at this time for a special two-part interview is former Upland Infinity biology teacher, now turned medical student, Mr. Sam Lyons. Mr. Lyons, thank you for joining us. To start things off, go ahead and tell us a little bit more about yourself.
All right. Hey, everyone. My name is Sam Lyons. I was a ninth grade biology teacher for several years, and now I am a third-year medical student, so about a year away from being a doctor. And basically, my background is science and medicine, and that is what I love and live for. And specifically for the past several months, I've been working with a team of doctors where we have been following this virus and this outbreak, and just reading everything we can in the medical journals and literature, just figuring out what we know and how to respond to this current pandemic, this crisis that we're dealing with.
Awesome. Well, thank you so much for joining us. Can you talk to a little bit about what exactly the coronavirus or COVID-19 is and how we contract it?
Yeah. So let's break it down into the different names that we hear about this virus. So coronavirus is the family of viruses that this is in. That can include some cold viruses, and in the past, SARS was a virus that was also a coronavirus. So that's coronavirus is the family. This specific virus name is called SARS-CoV-2, but the illness that we get from this is called COVID-19. And so COVID-19 is what I'm going to refer to this as throughout us talking together. Um, and just, what do we need to know about it? Symptoms can vary so much. You can, especially younger people, can feel like they have a cold, but fever, cough, shortness of breath, even things like diarrhea. We need to pretend or treat every little thing like it might be COVID to protect those around us.
One thing that I've been looking at is that it can stay present on different surfaces for different amounts of time. Can you tell us a little bit more about that?
Yeah, so there's been a lot of research that's been done over the past 3 months looking at different surfaces, how long, um, and the general takeaway from that is it can stay on surfaces for days at a time. Different research has shown, plastics or metals or cardboard to be longer. Really, the takeaway from that is we don't know enough about this, but what we do know is that it can stay on different surfaces for days at a time. So what I'm advising to people is that you get some disinfectant cleaner or Clorox wipes if you have them. They're not a lot left in supermarkets, but disinfectant cleaner and just wipe things down that you're bringing into your household.
So one thing I've noticed is that the different symptoms of COVID-19 are very similar to like the flu or a cold or things like that.
hmm
Uh, how do you differentiate, or how do we know what we have or don't have?
That's such a great question. And the answer to that is you don't differentiate. Right now, what's happening right now is unprecedented. It's, something that we've never dealt with, and we need to respond in a way that is unique and a heightened response. So anything that you think could be you're feeling a little under the weather or something, just you're just not feeling right, you need to treat it like you might have COVID and you might spread it to other people. So because the symptoms can vary so much from person to person and age group to age group, even if it's just a cold or a little cough or a mild fever, you got to treat it like it's COVID to protect the people around you.
On that note, currently Dallas County and several other counties around the state and different states around the country are under what we're calling lockdowns or shelter in place. Uh,
hmm
at, at what point can we see that that is being successful, or at what point do you think we'll be able to be free again?
Okay, free again, and that's a great question. So the problem with this virus is symptoms. Infection can last. There's kind of two parts of being infected. There's the incubation period when you don't have symptoms. That can last anywhere from 2 to 12 days, is what we're seeing. And we're also seeing that people can spread it while they're in that incubation period. So that kind of 2 to 12 day mark when you're not having symptoms, plus when you start having symptoms, it can be, I mean, at a minimum, 2 weeks of illness. Um, so when we're looking at like shelter in place, social distancing, these things that we are all needing to do to improve the health of our communities, um, the numbers that you see in your like online and your community right now as far as infections, those are numbers from 1 to 2 weeks ago that we've identified. We don't know the number right now because of the incubation period and because of the length of, people that are actively having infection right now. So how long are we going to know? How long until we know that these things are working? I mean, we'll know, a couple weeks to a month down the road if we're doing an okay job at slowing the spread. And how long are we going to shelter in place and do the social distancing? Gosh, I wish I could tell you that. But we all just need to prepare and be prepared and flexible for, you know, at least a month and probably more. Um, just just to be prepared and to acknowledge that this is unique and it could be a little while.
One thing that you touched base on is, the social distancing and being separated and isolated from others and things like that. What advice would you give to, and this is coming from a scholar perspective, let's say a scholar wants to go visit their girlfriend or boyfriend or family member, grandma, grandpa, things of that nature. What advice would you give to those kinds of situations?
Mhm. Yeah, and that's a question that I'm sure people watching this video are dealing with on a daily basis. So if you're kind of tuning out right now, open your eyes a little bit, wake up, and hear this. If you need to visit your girlfriend, boyfriend, friend that's your age, my advice is don't. Oh, stay in your home, go outside on walks, but don't interact closely with other people that are not in your household. If you absolutely have to, then physical um, physical contact, you need to cut it right now. And that doesn't mean you need to cut it forever, but you need to sober up to the reality of what's going on. And we need to just cut unnecessary contact with other people, because when we all do that, we slow the spread and we protect the people around us. When we talk about going and seeing your grandpa or grandma or, family friend who's, in their 40s, 50s or older and has diabetes or something else, you should not do that. You need to pretend like like you have the virus, because like we said, that incubation period can be anywhere from 2 to 12 days, and people can spread it during that incubation period. So people that are high risk, that means, 40s, 50s, older, also, have medical conditions like diabetes, high blood pressure, heart conditions, lung issues. You need to not be around them because you are protecting them by doing that. So that is my extremely important. Like, stay away from those people. You can video chat with them, you can say hi from like your window at a distance, but do not come into close contact with them.
It's a great way to summarize it. Um, on that note, what do we as a society need to do to help you guys in the medical community out? Like, especially as we're hearing things about shortages in masks, and I know commonly confused term ventilator versus respirator kind of thing. What do we need to
Yep.
do to help you out?
Yeah, so let's talk ventilator versus respirator, which we hear in the news, confused by news anchors all the time. So let's cut that clear. Respirator is masks that medical professionals use. Ventilator with a V is a machine that helps people breathe in the intensive care units, the ICUs of hospitals. So what can we do as communities? There are amazing people and companies out there, making cloth masks, which are better than nothing. And right now in medicine, we're looking at potentially not having anything as far as masks and protective equipment. So if you know people that are making things for the medical community, give them a hug from a distance, imaginary hug, social distancing, and just say thank you from all of us and from just society. So what can we do as far as the rest of us? Literally, we need to social distance. You are not going to see, at the end of the day, you're not going to get a gold star for what you did in social distancing that day. But when we all do it, you are saving lives. I promise you that. So that is what we all need to do.
Loosely worded question, if you will, but what else do we need to know?
hmm I I ask myself that question every day. But what else do we need to know? Let's just talk about one specific thing. What else do we need to know to protect the people around us? What is in our locus of control? What can we control to save those around us? We need to know, and we need to have household plans for self-isolation. So self-isolation is different than social distancing and shelter in place. Self-isolation, social distancing, shelter in place, those are all things that we are all doing to limit contact with everybody else in the community around us. Self-isolation specifically is if you think you might have symptoms, if anyone in your household thinks they might have symptoms, they need to isolate themselves within the household and not come into contact with anyone else they live with. And we'll talk about that more in the next video of how to do that. But I'm telling you, this is such an important thing that I wish was being spread around and communicated and taught more to communities, because it will save lives of the people you live with. Because if you don't have a plan for self-isolation, when one person gets infected, this disease is so infectious that the rest of the household is going to get it. So in order to prevent that, you have a plan in place. You can stop it right there with one person. And so we'll talk about that a lot more. But what else do we need to know? You need to know how to make a plan for self-isolation if someone has symptoms.
Awesome. Thank you for joining us. I do have one last question before we wrap up and get started with the second portion of our two-part interview. And we're going to provide sort of a resource here in a little bit, but what other help or resources are available for families, especially as we hear that testing kits are limited?
Mm-hmm. So first and foremost, I am not a doctor yet. Yes, it'll be a year, but my advice is to be taken as education. If you need medical advice, if someone has symptoms, you need to know what number you're going to call, whether that is your family doctor, if you have one, or whether that is a local urgent care. They are getting calls all the time. They have responses. They know what they're going to say and advise for different scenarios. So if you have questions, know what number you're going to call and explain your scenario and ask what to do, because the medical community will share that with you and be able to adapt it to your specific scenario. So that's kind of first and foremost. And then on top of that, when you're looking in the news, go to www.cdc.gov/coronavirus. We'll supply the actual links later, but go to government organizations and find news. Do not go on to like looking at videos from different news outlets. Right now, we need science, we need facts, and we need education based on that. So just be careful of where you're getting your information as well.
Thank you so much for joining us. Stay tuned for part 2 of our 2-part interview series, in which we'll go in depth and talk about what your plan needs to look like in case a member of your family is infected with COVID-19.